Welcome. You're watching the Bold Day of Television. I'm Christina Marie, your host, and today we are going to make over 240 minutes of impact with local nonprofits in Humboldt County. This is our rapid response to the ever-changing climate for funding for nonprofits in our current times. And we wanted to have a real conversation with Humboldt County's nonprofits about their mission, their needs, and how we can all help out together in Humboldt. So first up here, we have Maggie Kraft with Area 1 Agency on Aging. Hello.
Hi, how are you?
I'm good. Thank you for coming today.
Thank you for inviting us.
Of course.
Yeah.
Tell me about your agency. What is your mission?
Well, our mission is to support older adults and their caregivers and the community in general in living well, living healthy in their older age, and having the resources they need to do that.
So what does something like that mean? Like what's your signature program?
Well, most of our programs are Older Americans Act funded. So there's a lot of little programs that we do and that we're required to do. But I would say the program that the most people probably know us for is our High Cap program, which is Health Insurance Counseling and Advocacy Program, because we help people with Medicare. And Medicare is very complicated. And people have to look at their plans every year, their medicine plans, their prescription plans, and it's very confusing. So that's probably the program most people know about in our organization, although that we do a lot of other things.
So tell me a little bit more about this because I have aging parents and it is hard to surf that program. And with the rapid changing landscape, what is the most pressing issue or something that you wish the seniors watching right now knew about Medicare?
Well, I mean, Medicare serves people 65 and over for the most part. And I mean, there's a gap for folks who are under 65. And Medicare doesn't pay for everything. People think, oh, Medicare is going to be great. You still have co-pays. You still have to pay for other things. Um, and I think the trickier part is for people who are Medicare and maybe Medi-Cal, because that means they're eligible for both services because of their income levels. And we're worried about what's going to happen to Medi-Cal or Medicaid, it's called at the federal level. We know that there's a lot of things happening right now that would impact, especially what's called home and community-based services. That's the stuff that keeps people living independently in their homes.
Right.
So if the federal government cuts that funding, then the state has to figure out if they're going to pick it up or just cut services.
Right. And that might have a cascading effect, right? People losing their
Absolutely.
independence.
Absolutely. The thing that many people don't think about, if you have private insurance, um, you're good. You think you're great. You're doing okay. But our medical system is supported by all these different types of payers in the system. And if one big payer like Medicaid drops out, it's not like the Medicaid doctor just goes away. It's these doctors and nurses and everybody are paid by all those funding sources. So it can impact our healthcare system very, very hard because it's so on the edge in many ways anyway, but we need all those payers so that the local medical practitioners can do their work.
Right. The diversity in payers is better for the payees.
Yes, it's there for everybody.
Yeah.
And people, so when people say, "Oh, I'm not on Medi-Cal," or I don't subscribe or whatever, that's fine, but it could impact you anyway.
Right. Yeah. Because we're all in this together.
Yeah, we always are. People
Yeah.
don't always know, but we always are.
Yeah. That's one thing I'm really learning about Humboldt is that we really care about our neighbors here. We're behind that redwood curtain. And there is a large citizenry of senior citizens here. So tell me, what other programs are you doing to support those citizens here?
Right, and I wanna say that our percentage of population over 60 is the percentage is higher than in other parts of the state, although it's never as many people, but the percentage is higher. The other services we have, one that works is really popular is our volunteer driver program that is taking people to medical appointments, taking people to the grocery store, and that is can be as big as the number of volunteers we have. We can serve anybody where a volunteer wants to drive, and we provide mileage reimbursement. So and it's fun. I've done some rides. You sign up when you can, and you drive folks to what they need, and they're so happy. And you also get to interact with people that you might never meet otherwise. It's really a nice way to have that community, to support the community.
And stay a little social as well.
Yeah, exactly.
Yeah.
And our home share program, North Coast Home Share, goes a bit further and says, "Hey, do you have an extra room in your house you're not using? All the kids have moved out. You're in your home that you raised your kids. You don't want to move, but you're living there alone. It's getting a little harder. Your family might be a little pushing you a little bit to say, 'Oh, you can't live alone. You can't live alone.' But you want to rent a room out to somebody who can benefit from that, and you get a little money, you get companionship. They'll take the garbage out. Things happen."
Yeah,
Yeah.
right. It sounds really
Mhm.
good. Do you have any specific needs right now, like volunteerism or
Oh, absolutely. Our programs, even though they're federally and state funded primarily, that's where our money comes from, which is why we're watching what's happening so closely. But we could not do it without the volunteers we have. And if there were serious cuts coming down the pike, the only way we can sustain these programs would be with volunteers, more volunteers.
so I'm gonna go ahead and assume that if someone wants to volunteer, that they're gonna find you on your website. Is there more information at your website?
Yes, there is. There's information about all of our different programs, about volunteering, about other, well, connecting to other resources. There's probably more on there that most people want, but information about Medicare, information of programs, all our programs is right there on our website.
Great, and your website is again?
It's www.a1aa.org, and that's the number one, not don't spell it out and don't put an L.
Well, that sounds like a really good resource online. Do you have any goals this year for your fundraising? Do you have a number that you feel like you have to hit by December?
Oh, wow. Well, a lot of it depends on the state, because most of our funding comes from there, and then most of it's general fund. So we have not set a goal because it could be hundreds of thousands of dollars. But we're waiting to see what happens here with the state budget, especially. And we're going to do everything we can to continue to provide the most important services, that we can, the things that people need, advocacy for older adults in nursing homes. We can't just stop doing that work. We have to keep doing that work.
Right. So, do you take other things like in-kind donations? Do people donate cars? Do you have any of those programs lined up?
We don't do that, but we might start to. One of the things we've always done is not tried to compete with other nonprofits who are doing this. So if there's other nonprofits who take cars, let's not get in that. Let them do that. So what we have to figure out where the best place is for us to enter. Obviously, we're working with older adults, and so them thinking about estate planning and things like that make the most sense because they're using our service and they're also planning their what's going to happen with the money when they're gone.
Great. Well, I'm so glad that you're collaborating with us today and bringing more awareness to your organization and participating with the Bold Day at TV. Thank you so much for coming on and being our guest. For those of you at home watching, you can learn more about the Bold Day at TV by going to our website at accesshumboldt.net. You can also check out A1 Agency on Aging and stay tuned for more conversations about nonprofits and needs. In just a couple of words, what do you wish people would know about your agency?
Well, we're here to combat ageism, to remind people that we are all aging and we all either need help or can give help.
That's
And
perfect.
that's it.
Yeah, that's great.
Mhm.
We'll be right back after these messages. Stay tuned.